الرحمن الرحيم والصلاة والسلام على سيدنا محمد الهادي الأمين. اليوم راح نحكي عن Active Health Record and Acute Care. راح نحكي عن 3 نقاط في هذا الموضوع اللي هي ال Flow of Information وال Electronic Tools used in Documentation وال Technologies that's used in the HIM processes. راح of information. أول مرحلة في flow of information اللي هو registration. فهي بتبدأ مع ال health encounter first health encounter مع بداية ال encounter can occur at one time or at different times and include the collection of demographic and administrative information. The patient have to sign consent to treat, HIPAA notice, privacy practice, and the patient rights acknowledgement. The second stage is initial assessment, which includes the nursing notes, which are documentation of patient status or documentation of expectations. Then we have the recording of the vital signs. Number 3, medication administration record, where we record the medication given to the patient, the route, the time, the dose. Number 4, physician documentation. We have the attending physician who is responsible for the hospitalized patient in all ways, including the coordinating care, approving orders, and completing the health record. Number 5, we have the informed consent performed when a service carries a risk for the patient and is required by COP and TJC. The third stage is a list of main or legal requirements, which are the inpatient reports. First one is history and physical examination, which contains the reason for hospitalization, history of present illness, past medical, surgical, social, and family histories, review of systems, and physical examination. Number 2, we have the operative note, which include the date and time of the surgery, name of practitioner who performed the surgical task, pre-operative and post-operative diagnosis, name of the specific surgical procedure performed, type of anesthesia administered, complications if any if happened, description of techniques, findings, and tissue removed or altered, surgeon's or practitioner's name, and a description of the specific significant surgical tasks that were conducted by the practitioner other than the primary surgeon practitioner. And also it contains the prosthetic devices, grafts, tissues, transplants, or device implemented. And the last thing that the time, date, and authentication. Number 3, we have the physician's order. The order must be written for admission, transfer, discharge, medication, treatment, diet, ambulation, restraint, and all diagnostic tests. Number 4, physician progress note, written by physician to reflect the patient's current status or response to treatment. Consultation reports are ordered by the attending physician when they are seeking an opinion regarding the care and treatment of the patient. Discharge summary, this is the summarizing report of the patient hospitalization. It is dictated by the attending physician or the physician extender or resident. and it includes the reason for hospitalization, final diagnosis, significant finding from tests or procedures, procedures performed, response to treatment, condition on discharge, discharge instructions, and it have to be completed within 30 days of discharge. The fourth part is the other requirements, not the main requirements. It may be required or not. It includes the pathology, documentation of autopsy tissues or organs that need to be examined per hospital policy, anesthesia reports required when the patient undergoes any type of anesthesia, PACU اللي هي Post Anesthesia Care Unit, documentation of patient status while in recovery, imaging, radiologist interpretation of radiology tests used in diagnosis and or treatment of the patient, cardiac diagnostic including ECG and the interpretation, laboratory record of tests and interpretations or interpretation of the results, rehabilitation therapy, documentation of patients' response, goals, and progress towards order therapies. Respiratory therapy, record of pulmonary tests, administered oxygen, breathing treatments, and ventilation. Social services, documentation of assistance provided to the patient and family, assistance with the post-discharge plans, and help with DME. Obstetrics, record of obstetric services from the first office visit until after postpartum. Newborn care, record of patient's care from birth to discharge, including Apgar score. Special care, specialized documentation from intensive care unit, cardiac care unit, neonatal intensive care unit, dialysis or burn unit. Outpatient is documentation of outpatient care performed in various settings, justify the encounter, supporting the diagnosis and describing treatment and patient response. Clinical electronic tools and documentation. We have 4 electronic tools used in documentation: the CPOE, which is the computerized physician order entry, provides a more timely and accurate method of ordering tests and medication for patients. Result management system helps in the delivery of test results. PACS is the picture achieving and communication system. Is the image store systems used in radiology. Automated pharmacy solution efficiently dispense medication and reduce errors and increase patient safety. Regarding to the technology used in HIM processes, we have for the ADT, its admission, discharge, and transfer system. It ties the master patient index and the electronic health record together. It helps with reporting and allows the organization to work more efficiently. Second, we have the medical transcription and voice recognition technology, assist in clearer documentation in patient health records. Number 3, current documentation analysis and improvements allow the professionals to monitor documentation as the patient is admitted. The last one, barcoding, has increased the likelihood that patient information will be compiled and retrieved from the correct patient's chart. وهذا كانت نهاية درس اليوم فكان درس سريع شوي وما أخدنا فترة في التسجيل لأنه الامتحان قريب. باتمنى للجميع التوفيق.